Imagine being told that the cure to one of the most painful, really debilitating parts of menopause involved taking highly purified DNA from a fish and, well, rubbing it into your most intimate tissue.
I mean, when you put it like that, it sounds completely insane.
Right. It sounds like, I don't know, a late-night infomercial wellness scam or something.
Oh, absolutely. It really does sound like science fiction, at least until you actually see the cellular biology in action.
Exactly. Because usually, when we talk about measuring the success of a medical treatment, there is this expectation of absolute visual precision.
Right, like a clear cut before and after.
Yeah, like engineering.
Yeah.
You break your arm, the X-ray shows a jagged white line, the doctor sets it, and then weeks later a new X-ray shows solid bone.
Yeah.
They can just point to it and say, there it is, the bone is fused, you are healed.
Right. It's binary, it's visual, it's clean, and most importantly, it's completely objective. I mean, you really can't argue with a bone fusing on an X-ray.
But then you step into the world of women's intimate health, specifically the changes that happen during menopause, and suddenly that metaphorical X-ray machine seems completely broken.
Oh, totally broken.
For decades, the diagnostic landscape here has been, well, honestly, it's been incredibly murky. It has historically relied almost entirely on women just describing their discomfort to their doctors.
Which, is obviously valid, but very hard to quantify on a medical chart.
Right.
It's the absolute definition of diagnostic muddy waters.
Right.
When you are dealing with something like genitourinary syndrome of menopause, which we call GSM, the symptoms are subjective by nature.
Like pain and dryness.
Exactly. Pain, dryness, itching. But the underlying physiological degradation of the tissue is very, very real.
Yeah.
So the challenge for the medical community has always been how to objectively prove that a treatment is actually repairing that tissue rather than just, temporarily masking the discomfort with a lubricant.
Well, welcome to this deep dive. If you're joining us, you are likely someone who loves to learn, who asks the big questions, and you might already be aware that women's intimate health, specifically GSM or vaginal atrophy, is finally getting the rigorous scientific attention it deserves.
It really is, finally.
Our mission today is to explore this fascinating non-hormonal regenerative treatment using these fish DNA fragments, which are known as polynucleotides.
Yes, polynucleotides.
But we aren't just going to marvel at the treatment itself. We are going to look at the hard science of how clinicians prove it works. How do doctors look past the patient's subjective feelings to objectively measure tissue regeneration? Okay, let's unpack this.
I am so glad we are starting here because in a world that is just completely saturated with wellness fads, quick fixes, and over-the-counter moisturizers that promise the world but deliver very little.
Oh, there are so many of those.
So many. And having objective clinical metrics is absolutely essential for proving real medical efficacy. You just cannot build a foundation of regenerative medicine on asking a patient, hey, do you feel a little better today?
Right, you need actual data.
Exactly. You need rigorous, verifiable tools. And in this space, those diagnostic tools are the Vaginal Health Index, or VHI, and the Vaginal Maturation Index, the VMI.
VHI and VMI, got it.
Yep. These indices are essentially the clinical lie detectors that tell us if a treatment like polynucleotides is genuinely rebuilding the tissue from the ground up.
But before we can understand how doctors measure the cure, we really need to understand the physical crisis that is occurring in the tissue itself.
Right, the baseline.
What is actually happening during genitourinary syndrome of menopause? Because just reading through the clinical notes, the word discomfort feels like a massive understatement.
Oh, it is a huge understatement. It all comes down to estrogen, or rather the sudden and drastic lack of it. During peri- and postmenopause, estradiol levels plummet. I mean, they can go from premenopausal peaks of around 800 picograms per milliliter all the way down to below 30.
Ah, that's a massive drop.
It is. Now, estrogen is essentially the master architect of the vaginal environment. It dictates the structure.
So when that architect disappears,
the architecture physically collapses. The vaginal epithelium, which is that surface layer of tissue, it literally flattens out. It loses its natural accordion-like folds, which are called rugae, and it becomes incredibly thin.
And when you say thin, we're not just talking about delicate skin here. We're talking about tissue that is tearing or microbleeding just from walking around or sitting in a chair, right?
Exactly. The thinning exposes the underlying connective tissue. You see the development of what we call petechia, which are these tiny pinpoint microbleeding spots right under the skin.
Ugh, that sounds awful.
It is. The tissue becomes incredibly friable and easily inflamed, but the structural collapse is really only half the crisis. The chemical environment drastically changes too.
Yeah, this part blew my mind when I was looking at the sources. The cascading effect of losing that one hormone.
Yes, because a healthy estrogenized vagina is rich in glycogen, which is essentially cellular sugar.
Okay.
And that glycogen feeds the good bacteria, primarily lactobacilli. Those bacteria eat the glycogen, and they produce lactic acid, which keeps the environment highly acidic, usually around a pH of 4.0 to 4.5.
And that acidity acts like a shield.
Right, exactly. It keeps pathogens and infections out. But when estrogen drops, the glycogen vanishes. The good bacteria basically starve to death, and without them producing lactic acid, the pH spikes, becoming much more alkaline.
So you lose the structural thickness and you lose the acidic force field all at once.
All at once.
The tissue is prone to chronic inflammation, tearing, and constant infections. It is a total ecosystem collapse.
That's the perfect way to describe it.
Which brings us to the intervention. If estrogen is the master architect that went missing, how do we rebuild this collapsed architecture without just pumping hormones back into the body?
Right, which is a huge issue for many.
Exactly, because that is the trap a lot of women are in, especially breast cancer survivors. They absolutely cannot take estrogen. So what is the alternative?
Well, that is where the polynucleotides come in. These are highly purified DNA fragments, often derived from trout or salmon gonads.
I mean, I still can't get over that.
Yeah.
Fish DNA to cure human menopause symptoms.
I know. It sounds wild, but what's fascinating here is that on a molecular level, DNA is the universal language of life.
Right.
Polynucleotides are natural, biologically active molecules. They are complex polymers made of nucleotides. And when you highly purify them, which is crucial because removing all the fish proteins means they won't cause an allergic reaction.
Oh, that makes sense.
Yeah, you are left with just a fundamental building block.
Yeah.
When these polynucleotides are introduced to the atrophic vaginal tissue, whether that's through creams, ovules, or intradermal injections, they do not act like hormones.
Okay.
They act as regenerative scaffolds.
Okay, but how exactly? I need to understand the mechanism here. What are they physically doing to the cells when you apply them?
They do a few brilliant things, actually. First, their three-dimensional structure attracts and holds massive amounts of water, which provides immediate, profound hydration to the extracellular matrix.
So instant moisture.
Yes. But more importantly, they chemically signal the body's own cells. They stimulate fibroblasts, which are the biological factories in our connective tissue.
Oh, okay.
They basically tell these dormant fibroblasts to wake up and start aggressively producing fresh collagen and elastin. And they also do something called scavenging free hydroxyl radicals.
Scavenging. What does that mean in this context?
Think of free radicals like microscopic rust that is actively damaging the tissue through oxidative stress.
Right, oxidative stress. We hear about that a lot.
Exactly. The polynucleotides act like a molecular sponge, soaking up that rust and neutralizing the inflammation so the tissue can finally heal. And I have to admit, I get a little too excited about this next part, but they trigger what's called the salvage pathway.
The salvage pathway.
Yes. So building a new DNA chain from scratch takes a ton of cellular energy. But if you provide broken down DNA fragments, like a bucket of loose Legos, the cell's salvage pathway grabs those pre-made pieces and snaps them right into its own repairing structure.
Oh, well. Right.
Yeah, the body enzymatically recycles these fish DNA fragments into free nucleotides for rapid cellular repair.
Oh, that makes perfect sense.
Yeah.
So instead of just, spackling over a crack in a wall with a temporary moisturizer or using estrogen to artificially prop the house up,
Right.
polynucleotides are like dropping off a massive pile of bricks and blueprints at a construction site and telling the body's lazy fibroblasts to get back to work building the house on their own.
That is a biologically perfect analogy. They are literally providing the raw materials and the chemical blueprints for the tissue to rebuild itself.
Which begs the question, if we dropped off the bricks, how do we know the house is actually being built?
Exactly.
How do we know it is not just the patient experiencing a placebo effect from that deep hydration you mentioned? We need our clinical lie detectors. So let's look through the macroscopic lens first. How does a clinician independently verify this?
Well, that brings us to our first clinical tool, the Vaginal Health Index, or VHI.
Right.
The VHI is an investigator-assessed grading scale. It requires the clinician to physically examine the tissue and grade it across 5 highly specific parameters on a scale of 1 to 5.
And what are those parameters?
They are overall elasticity, the type and consistency of fluid secretion, the intravaginal pH, the integrity of the mucosal epithelium, and overall moisture.
Okay.
A total score can range from 5, which is the absolute worst condition, up to 25, which is perfectly healthy. Any score under 15 confirms severe vaginal atrophy.
Wait, hold on. A scale of 1 to 5 based on a doctor just like looking at the tissue.
Yeah.
That sounds incredibly subjective. If a doctor is just looking and deciding, I think that elasticity is a 3 today, how can you possibly call that an objective medical metric? Isn't that just a doctor's opinion?
That is a completely fair challenge, and it is exactly why the VHI rubric is so rigidly defined. It is not about the doctor's general feeling, it is about observable physical threshold.
Okay, give me an example.
Let's take the mucosal epithelium parameter. The doctor's looking for those petechia, those tiny microbleeds we discussed earlier. The rubric totally removes the guesswork.
How so?
A score of 1 means the mucosa is so degraded that petechia are noted before the doctor even makes physical contact with the tissue.
Oh, wow.
Yeah. A score of 2 means the tissue bleeds with only light contact. A score of 3 means it requires active scraping to induce bleeding. A 4 means it is thin but not friable, and a 5 is normal, robust mucosa.
Ah, I see. So the clinician is essentially running a physical stress test on the tissue and documenting the exact failure point.
Yes.
It is not looks good versus looks bad. It is bleeds on sight versus bleeds on touch. That is a very distinct, measurable difference.
Precisely. It is highly standardized. And when we apply this rigorous tool to polynucleotide treatments, the data is just astounding.
What kind of data are we talking about?
For instance, there is a real-world study in our sources by Alessandri and colleagues involving 54 women. Over just a few weeks of using a polynucleotide-based ovule, the clinicians, using this exact VHI scale, recorded a 59.8% improvement in vaginal hydration.
Wow, almost 60%.
Yes, and a 52.7% improvement in secretions, and a 51.6% improvement in the reduction of those superficial petechia. Even the deep tissue elasticity improved by over 50%.
That is massive. And there's another study in our notes too, right? The Levitola study, focusing specifically on breast cancer survivors.
Yes, very important study.
Because as we mentioned, these are women who often suffer from severe medically induced menopause because of their cancer treatments.
Yeah.
And they absolutely cannot use estrogen therapy.
Exactly.
In that study, using a polynucleotide cream, the mean VHI scores jumped from an atrophic 11.9 to a healthy 17.6 in 6 months.
Right. And if we connect this to the bigger picture, moving from an 11.9 to a 17.6 is not just some statistical anomaly on a spreadsheet.
No.
It means a woman has crossed the clinical threshold from severe, debilitating atrophy back into the realm of healthy, resilient tissue.
Yeah.
It also means that the third parameter on the VHI, the intravaginal pH, is dropping back down from an alkaline state to that healthy, protective, acidic range of 4.0 to 4.5. The environment is actively rejecting pathogens again.
You know, it's easy to get lost in the clinical data here, going from 11.9 to a 17.6. But if you're listening to this and you've gone through medically induced menopause, or you're just navigating a really severe natural transition, you know exactly what that number jump actually means.
Absolutely.
It's the ability to sit down in a chair without wincing. It's the ability to exercise, to wear jeans, to just exist without chronic irritation. It's really getting your life back.
It absolutely is. But as fascinating and vital as that macroscopic view is, the deep dive doesn't stop at what the naked eye can see.
Right, because the VHI proves the tissue looks and behaves better to the clinician in the room. But to understand the true mechanism of regeneration, we have to look at what is happening at the microscopic cellular level.
Exactly.
If the bricks and blueprints were delivered, are the cells actually building? And to answer that, clinicians use our second tool, the Vaginal Maturation Index, or VMI, the microscopic proof. So how exactly does a clinician measure the VMI?
The VMI requires a cytology swab, which is very similar to how a standard pap smear is performed. The clinician takes a gentle swab of the cells from the upper third of the vaginal wall and sends it to a laboratory.
Okay, pretty standard.
Yep. Then, under a microscope, a technician randomly counts exactly 100 cells. It's a statistical sampling. They then categorize those 100 cells into 3 distinct types based on their level of maturity.
And what are those 3 types?
At the very bottom, you have pericasal cells. These are small, immature, underdeveloped cells with large nuclei that indicate an environment entirely devoid of estrogen.
Okay, parabasal.
Right. In the middle, you have intermediate cells, which show mild maturation and structural development, and at the top, you have superficial cells. These are large, flat, fully mature, robust cells that indicate a highly estrogenized, healthy environment. The lab reports the result as a ratio of these 3 cells out of a 100 cell count.
Here's where it gets really interesting. Think of the vaginal lining like a forest.
Oh, I like this.
The parabasal cells are the tiny seeds and fragile little saplings on the ground. The intermediate cells are the growing mid-sized trees. And the superficial cells are the massive, fully grown canopy trees that protect the forest floor.
Yes.
What you were saying is that severe vaginal atrophy leaves you with a forest that is stuck entirely as vulnerable, tiny saplings.
That is a beautiful and highly accurate analogy. In a healthy, menstruating woman who is at the peak of ovulation, her VMI ratio might look like 0 to 35 to 65.
Okay, so 0 parabasal saplings, 35 intermediate trees, and 65 fully mature canopy trees protecting the tissue.
Exactly.
Okay, but what does the forest look like in a postmenopausal woman with atrophy?
The ratio completely inverts. You might see a cytology report with a ratio of 90 to 10 to 0.
Wow, 90 saplings and 0 canopy trees.
Exactly. 90% of her tissue is stuck as immature, fragile parabasal cells, and she has absolutely 0 mature superficial cells. It is a complete biological shutdown.
That sounds intense.
It is. And this yields a calculation called the maturation value, which drops drastically in atrophic patients. The cells simply cannot grow up without estrogen signaling them to mature.
Or at least, that is what we used to think. Which brings us to the most incredible part of this research. What happens to that barren forest of saplings when you apply the polynucleotides, when you introduce the fish DNA?
This raises the most important question because, remember, we are not introducing a single drop of external estrogen here.
Right.
Historically, the medical community believed you needed estrogen to force those cells to mature. But the data shows otherwise. In a double-blinded, randomized controlled trial, specifically the VABIP trial led by Ocampo Godinez, patients treated with polynucleotides showed a highly significant augmentation of intermediate cells on their VMI.
Wait, so the DNA fragments, without any hormones present at all, actually signaled the cells to grow up?
Yes. The polynucleotides essentially hacked the cellular signaling pathway. They provided the biochemical scaffolding and the instructions for the parabasal cells to mature into intermediate cells, rebuilding the epithelial layers from the basement membrane up.
That is wild.
The cytology proves that actual biological regeneration is occurring at the microscopic level. The saplings are actively growing into trees again, and they are doing it entirely without estrogen.
That is truly mind-blowing. We have the macroscopic proof with the Vaginal Health Index showing the tissue stops bleeding and regains elasticity on a physical stress test.
Yes.
And we have the microscopic proof with the Vaginal Maturation Index showing the cells are literally maturing and rebuilding the forest. But do the numbers match the feeling?
That is the big question.
How does this clinical data translate into the actual lived experience of the patient?
Well, that is the ultimate test of any medical intervention, right? Clinicians use these objective indices, the VHI and VMI, to validate the subjective quality of life questionnaires that patients fill out.
Like what kind of questionnaire?
These are validated tools like the Vulvovaginal Symptoms Questionnaire, the VSQ, or the Female Sexual Function Index. For a long time, if a patient said she felt better after trying a new cream, doctors couldn't always prove why, or if it was just a placebo effect.
Yeah, that makes sense.
But now, they can overlay the subjective answers with the objective data.
Do they match up?
Perfectly. The sources detail a study by Barobia Perez looking at patients who underwent intradermal polynucleotide and collagen treatments. When their VHI scores jumped into the healthy range, the patient questionnaires mirrored that success in an unprecedented way. 100% of the patients reported improvement in itching, burning, and dryness.
Let that sink in. 100%.
Yes, every single one. Furthermore, their baseline pain scores on a 10-point visual analog scale dropped from a severe 5.9 down to a 0.8.
Wow.
And for those experiencing dyspareunia, which is pain during sexual intercourse, their pain scores plummeted from an 8.7 out of 10 down to a 2.0.
Going from an 8.7 to a 2.0. That is the difference between avoiding intimacy entirely out of fear of excruciating pain and reclaiming a vibrant, normal sex life.
It really is.
It's not just about tissue. It's the restoration of intimacy, of relationships, of basic human connection.
And crucially, it validates that 100% of the patients in that cohort reported that their symptoms were no longer causing them frustration, embarrassment, or negatively impacting their social interactions.
That's amazing.
When the VMI shifts away from parabasal cells and the VHI proves the tissue is thick and hydrated, the clinical data definitively proves that the patient's suffering has been alleviated on a deep structural level, not just masked.
So what does this all actually mean for you, the listener? It means that we are entering a new era of women's healthcare. By utilizing incredibly rigorous objective tools like the Vaginal Health Index and the Vaginal Maturation Index, the medical community can finally offer a scientifically validated lifeline that doesn't rely on hormones.
Absolutely.
It proves, beyond a shadow of a doubt, that regenerative medicine, using fundamental building blocks like polynucleotides, is a viable, measurable reality.
It is a profound shift in how we treat aging tissue. For decades, the only gold standard was estrogen replacement.
Right.
But for millions of women, breast cancer survivors, those with a high risk of thrombosis, or simply women who prefer not to use hormone replacement therapy, that gold standard was a locked door.
Yeah.
Polynucleotides have opened a completely new door, and the VHI and VMI are the scientific proof that what lies behind that door is genuine, measurable healing.
We have covered so much ground today. We've journeyed from the macroscopic grading of tissue elasticity and physical stress tests all the way down to a lab technician counting 100 individual cells under a microscope to watch them mature from tiny saplings into thriving trees.
It's been a great discussion.
Thank you so much for joining us on this deep dive into the microscopic and macroscopic world of intimate tissue regeneration. We've seen how the VHI and VMI serve as the ultimate clinical lie detectors, holding new treatments accountable and proving that relief is possible.
And I want to leave you with a final thought to ponder, something that extends even beyond what we've discussed today. We've just explored how applying purified DNA fragments from a fish can chemically signal human vaginal tissue to regenerate, to mature, and to act decades younger, all without introducing a single human hormone.
Yeah.
If our cells are this highly receptive to the basic universal building blocks of life, what other chronic age-related degeneration in the human body could we potentially hack simply by speaking to our tissues in the universal language of DNA?
Wow. That is a brilliant question to end on. As always, keep questioning, keep exploring, and never stop diving deeper into the science that shapes our lives. We will catch you next time.